There are certain milestones in life that we approach with a mix of excitement and maybe some trepidation. For some, hitting 60 may be one of them. So today, we have a little inspiration, of course. We are tearing a page from the classic pinup calendar. Happy to welcome Dr. Bill Wolf, who is the CEO of Central Ohio Primary Care, along with one of the 13 60 Strong ambassadors, Bill Davidge. So welcome to you both.
Thank you. Thanks for having us.
All right, Dr. Wolf, 60 Strong is kind of this collaborative effort we were talking about. Agilon Health is one of them, Central Ohio Primary Care Physicians, and then COPC Senior Care Advantage Program. So all of these things together, really, what was the inspiration to get this done?
Robin, COPC Senior Care Advantage is a partnership with agilon. COPC is involved with 4 Medicare Advantage plans in the city: Aetna, Anthem, Humana, and Medigold. And COPC Senior Care Advantage is a set of programs we've developed to bubble wrap our patients and our seniors, whether they be rising risk or high risk. It's a chance for us to just take better care of those individuals. And we thought that encouraging our over 60 patients with stories about people that have overcome some obstacles in their life and including them in a calendar, in a pinup type calendar, and the calendar has lots of information in it that's good for patient care.
And so the calendar kind of highlights them, as you mentioned. It tells these personal stories, and we call them these ambassadors. So what was it in general about these 13 special people that made them stand out and kind of earn a place on one of the pages?
Sure. So these ambassadors were nominated by our offices. We have 70 offices in Central Ohio, and every office had the opportunity to nominate people that they felt stood out. And then we had a number of judges that chose the individuals that they thought best exemplified the strength to overcome an obstacle and stand out for others for health care.
All right, I'm going to ask you, Bill, what month are you, first of all?
This year I was January.
Okay, so I can just call you Mr. January.
That'd be
Bill.
great.
So, okay.
That'd be great.
Some people may recognize you as well. You're an analyst for the Columbus Blue Jackets, now obviously a pinup model. You might not have wanted or thought you'd put that on your resume, right? But gladly you'll take it. So what was your reaction when they came to you and said, all right, we want to put you on this calendar?
I was, who nominated me? I want to talk to whoever nominated me.
We can't tell.
And I found out it was one of my past students when I was teaching and coaching at Miami University. He gave me a little warning that, you know what, Bill, I nominated you for a little bit of something that you may, don't take it personally. But he said, I'm so happy with what you're doing. And so it was kind of a reward to say, hey, I've noticed your life, what you've been able to do, and so I put your name forward.
And so what exactly is that? Because you share a bit of, maybe heartbreak and just personal story you've gone through.
Well, I've had, just a little bit of everything. Back in 1985, my late wife, Leanne, was a tennis coach at Miami. She was killed in a car accident, and I was left with a 13-month-old son at that time, so I had to sit back and raise him. And I didn't want to give up my coaching, but eventually I did. I took a year off and then ended up getting back into the hockey industry. And I've been with the Columbus Blue Jackets now. This is my 20th year. But 4 years ago, I was diagnosed with multiple myeloma. And basically right now, continue to fight it. I'm back into the James every 2 months to be able to get some blood work done to see what my status is. I've been in remission for the last year and a half, and let's hope that we can continue to do that as time goes on.
Absolutely. Well, cheers to that. That's incredible in itself. So, you kind of have to stay positive through all these. And of course, I'm sure hockey kind of helps, but how is it that you maintain, or what advice would you have to somebody to stay strong even when life maybe hands you some tough stuff?
Well, the biggest thing is that attitude is the biggest thing. It's a little thing that can make a big difference. Yeah. And for me, every day I get up, and I feel like you've got to do something. You've got to stay busy. You got to pay forward. One of the things that I do in the course of the summer is I fundraise for my cancer. We have golf tournaments. We have had a dinner this year that in the last 4 years, we've been able to raise over $110,000.
Wow.
For my doctor's research. And that's the plight, as Woody Hayes would say, pay forward. Yeah. And that's part of my life right now.
No small feat for sure, so thank you for doing that.
Thank you.
And Dr. Wolf, the other thing, 60 can be a tough time for people, and maybe they need to just get a little bit of that positivity, right? I mean, shouldn't we all be happy that we made it at some point, right?
Well, and I have always told patients the goal is to get to 85, wear orthopedic shoes, and enjoy it. So, you know, oftentimes patients would come in and say, I just feel old, and that's the goal. The goal is to get to a ripe old age, and people like Bill help encourage our patients to get there.
Absolutely. All right. Well, thank you guys so much. If you want to learn more about the calendar, COPCSeniorCareAdvantage.com is a website you want to visit. And thanks again for sharing with us.
Thanks for having us.
Open.
Appreciate it.
Absolutely.
Thank you, Robin.